CAR T is a very new therapy, new cellular therapy that is in which we collect immune cells called T cells from patients who have different types of cancer, especially blood cancers. And these T cells or immune cells are genetically modified, genetically engineered, and effectively reprogrammed to be able to recognize and attack the cancer, in most cases a blood cancer like leukemia, lymphoma, or myeloma. And these cells are capable of becoming activated and proliferating, expanding in response to their recognition and attachment to the cancer cells, and they effectively become serial killers. The cells or the progeny of these cells are able to kill multiple cancer cells, and often very rapidly.
The prep that is involved with CAR T cell is somewhat similar to a stem cell transplant in that they really need to make sure that your body is set and okay and can handle CAR T cell. And so that does involve a lot of testing, but essentially they will do something called apheresis, where they will take your blood cells and transform it into those mutant T cells.
Patients get a specialized catheter placed, and then they're connected to a machine called an apheresis machine that withdraws the cells of interest, which are the immune cells or the T cells. And this is a process that can take 4 to 6 hours of collecting time. And then these cells then undergo a manufacturing process that can take about 2 to 4 weeks, during which time the cells undergo genetic modification and genetic engineering to introduce a gene that encodes the CAR, which stands for chimeric antigen receptor, which is kind of a freak of nature. It's a product of synthetic biology, but basically it results in a new protein getting expressed on the surface of the cell that enables the cell, the immune cell, to be able to recognize and attack the cancer, and then delivers important signaling.
And you get basically what is a blood transfusion of your own blood back into you, and it can be pretty uneventful. At least for me, it was very uneventful, which is a good thing when it comes to cancer treatment. I was told, around day 4 or 5 is when most people will start feeling some symptoms. They call it CRS, cytokine release syndrome, and it can start with a fever, and that's what happened to me. So I had a fever, and then actually very quickly, I had to be put in the ICU. The fact that, Dr. Rapoport and his team told me these expectations of what to come, when they told me, okay, we're gonna take you to the ICU, it wasn't scary. Like, it just was like, okay, if anything, they told me that means it's working.
It seems to result in long-term remissions and cures in approximately 50% of patients with lymphoma and leukemia and also myeloma. So it doesn't work for everybody, and the patients that it's usually used for are patients whose disease has come back multiple times.
At the time, I was out in about 11 days after that first infusion. So CAR T cell really was a miracle for me, and I truly hope that it can be first-line treatment for people.
Ever since her first scan after the CAR T therapy, she's been in complete remission, and she's now more than 5 years out and doing great and doing wonderful things in her life.